Okay, so let's go ahead and begin. Welcome, everyone. This is the webinar from the Civil Society Engagement Mechanism of UHC 2030. It's an informational webinar on the UN high-level meeting on universal health coverage. Simon, can you hear me okay? Can you just speak real quick? I'm unmuting you. Go ahead.
Thank you. Hi, Eliana. Hi, everyone.
Great.
Thanks so much for joining this.
Okay, so my name is Eliana Monteforte. I am the Secretariat for the CSEM. This is me right here. Simon, do you want to introduce yourself? Go ahead, Simon.
Thanks. Don't have
Just leave
control over.
yourself unmuted, it's easier.
I don't have control. No, you're muting me, I think.
Oh, I
It's not
am?
me.
I'm sorry, go ahead.
I don't have control of my own microphone. Hi, so my name is Simon Wright. I am Director of International Development Policy at Save the Children, and I'm part of the Civil Society Engagement Mechanism. I represent the Northern Civil Societies on the steering committee of UHC 2030.
Great, thank you, Simon. So here's an outline of our webinar. So I'm just going to start by giving you all a bit of an introduction on what UHC 2030 is, and the Civil Society Engagement Mechanism, which we call either CSEM or CSEM. And then we'll have Simon go into what the high-level meeting on UHC is, and then the ways you can participate in the lead up to the high-level meeting on UHC. So there are going to be a lot of opportunities through UHC 2030 as well as through the CSEM to be able to provide inputs to the high-level meeting and participate in other activities. So we'll talk about those. And then there are different ways that you can also participate after the high-level meeting. We are going to do a presentation first, so if you can hold your questions for the second half of the webinar, which will be the question and answer session. If you do have a question, you can raise your hand and I'm happy to unmute you so that you can speak. And if you're more comfortable writing your questions in the chat box, we're monitoring those as well. So feel free to just type in your question and we can read it out loud and answer it. So a little bit about UHC 2030. So we will, sorry, before I begin, post the recording of the webinar on our CSEM website, and the slides will also be included. So all of these blue links that you see here, you'll have access to once you have the slides. But the mandate of UHC 2030 is basically it provides a platform for multi-stakeholders to promote collaborative working in countries and globally on health system strengthening. And it really works hard to advocate to increase political commitment to universal health coverage and facilitate accountability and knowledge sharing. These are just some of the activities that UHC 2030 does, but if you go on their website, you'll definitely be able to get more details as to what they're currently working on. But to improve coordination of health system strengthening efforts for UHC at the global level, strengthening multi-stakeholder policy dialogue and coordination of health system strengthening efforts in countries, facilitate accountability for progress towards health system strengthening on UHC. Building political momentum is a really important one around the shared global vision of health system strengthening for UHC. And then this is another big one, but advocating for sufficient, appropriate, and well-coordinated resource allocation for health system strengthening. So the way UHC 2030 is governed, it's hosted by the World Health Organization as well as World Bank. And it does have a steering committee, which is kind of like the governing board that provides oversight and decision making. It has 20 members and it has 9 country seats within those 20 members, 3 multilateral organizations, and then there's representation, of course, from the World Bank and the WHO, 1 philanthropic foundation, And then we actually have 3 civil society seats, not 4, excuse the typo, we'll fix that. But these seats actually come from the civil society engagement mechanism, and as Simon has already shared, he's actually one of the steering committee representatives that is from the civil society that sits in the steering committee, and then there's 1 private sector seat. In terms of their membership, historically, they have had 66 existing partners that include governments, international organizations, civil society, private sector, academia, and media. But they've certainly been increasing their membership over time. I don't have the exact number of the membership, but you might be able to find that information online. And if it's not there, you can just email me and I'm happy to find the information for you. And there is a process if you'd like to join the UHC 2030 movement where you commit to the Global Compact. There's a whole application process. If you click on the link here, you'll be able to access information on how to do that if your organization's interested in joining this movement. So that's UHC 2030. Now, part of UHC 2030 is the civil society engagement mechanism. So we're the civil society arm of this entire global platform. And our mandate is really focused on raising civil society voices in the entire UHC 2030 movement. And we want to make sure that all UHC policies at the national and global level are inclusive and equitable, and making sure that we're focusing on the poorest, most vulnerable people so that no one's left behind. So that's our mandate, and that's what we focus most of our activities on. Here again is a sample of our activities. And like I said, if you want to go on our website, here's the link under CSEM. But we do influencing policy design and implementation, lobby for participatory and inclusive policy development and implementation processes, strengthen citizen-led social accountability mechanisms, promote coordinations between CSO platforms and networks, and we also do a lot of knowledge creation on existence and sophistication of existing national level infrastructure for civil society on UHC. I'd have to say that our online platform is going to provide you all with a lot of information as to what our different civil society members are doing. We share a lot of UHC 2030 and CSEM documents on our platform as well. And you also can join the CSEM through the platform and also write to us if you have any questions or want to participate in any particular activities or share any of the work that you're doing. So that's really serves as our knowledge sharing platform, and I really recommend that you take a visit and see which ways you can participate. So we have what's called an advisory group, and their job is really to link the global and national levels to ensure that there's CSO diversity and sets constituency priorities based on national inputs. And it also acts as a technical hub for the overall CSEM. So they're connecting a lot of what's happening at the national level to the global level and vice versa. And then a lot of the technical activities that we lead as the CSEM, the advisory board, does a lot of the design and implementation of. The advisory group is composed of 18 members, and if you click on that link, you can go to our CSEM website to get pictures and bios of all of our members and see globally how we're represented and what different organizations the advisory group comes from. So it also includes 3 CSO representatives that sit on the steering committee, like I said. We have 3 active steering committee members, and then we also have 3 alternates. So if any of our active steering committee members can't be in the steering committee meetings for UHC 2030, we always have our alternates attend to ensure that civil society is part of all of those UHC 2030 conversations. In terms of our membership, right now we have about 500 individuals, but that's growing very rapidly, from over 250 organizations from over 50 countries. And again, if you go on our website, you can actually see a map of where in the world we have different members for the CSEM. You can click on a specific country and it'll give you a drop-down list of the names of the different organizations. And if you do want to join, like I said, you can go ahead and go on our website, and there's a join us button that you can press, and it's a really, really short process. You just have to fill in a quick survey monkey, and then we review your application and add you to the CSEM. So with that, I'm going to unmute Simon, and I'll let Simon continue with the presentation. Go ahead, Simon.
Thanks, Eliana. So yes, everyone, I hope if you're not already a member of the CSEM, please make sure your organization signs up, because this is meant to try and represent all of civil society working on all aspects of health around the world. But what we're talking about today is primarily the UN high-level meeting on universal health coverage, which is going to take place in September in New York as part of the UN General Assembly. And so this is convened as part of the UN General Assembly, which is the annual meeting. In fact, it meets more often, but this is the kind of high point of the UN General Assembly every September. And we've had for a while some governments really championing universal health coverage through the UN. Now, of course, usually health is discussed at the World Health Organization, but taking it out of that and into the UN implies a much higher level of commitment by governments to a particular topic. And Thailand has been a very instrumental government in pushing this through the UN, including things like they have established Universal Health Coverage Day on the 12th of December as an official UN day. We had it as an unofficial day for a long time, but now it's an official UN-approved day of recognizing universal health coverage. And they also passed a resolution to hold a high-level meeting on universal health coverage at this year's UN General Assembly. And the idea is meant to be an opportunity to agree cooperation activities that are going to be taking place by member states. The most important bodies within the UN, of course, are the member states, on achieving universal health coverage in line with the Sustainable Development Goals target of 2030. So we're expecting some heads of state and some ministers to take part in the meeting on the 23rd of September, and there will definitely be some outcomes from that meeting. If we can go to the next slide, please. So one of the things that will come out from it is going to be a political declaration, a communique from the UN high-level meeting. And that's going to be very important because it's going to be giving a kind of global direction towards efforts to achieve universal coverage of high-quality healthcare without causing financial hardship by the way that they're paid for. And that's as defined in SDG target 3.8. People remember that goal 3 in the SDGs is on health. At one stage, it was going to be that goal 3 was all about universal health coverage, but there's a lot of politics around health, as we all know, and it got suppressed and pushed down to become target 3.8. However, since the SDGs were agreed, universal health coverage has really been emerging as the most important linking commitment under the SDGs. So whether you are concerned about, I'm looking at the list of participants, whether you're concerned about HIV, whether you're concerned about maternal mortality, whether you're just concerned about broken legs, whether you're concerned about infectious diseases, about drug use, sexual and reproductive health, then universal health coverage is the big linking commitment, because none of those targets can ever be achieved if a government doesn't organize a functioning quality healthcare system which everyone can use, whether they are rich or whether they are poor. And it's also an opportunity for countries to make commitments. They'll all make speeches, the ones that take part in the high-level meeting, whether they're ministers or heads of state. And so the kind of things they say there could be very important for how serious they are about moving their country closer to universal health coverage by the target date of 2030. Next slide, please. And it really is at national level. I want to kind of just talk a little bit about this balance between global and national. We all know that the SDGs are a voluntary set of commitments. All governments signed up to them. They said they were going to achieve all 17 goals by 2030. And there are some mechanisms to try to hold them to account for that, such as the high-level political forum that happens every July, I think, at the UN. But all of these are voluntary measures. And depending on your point of view, it's primarily, I would argue, at national level that these commitments are made and where they can be held to account. If governments say they're going to do something, if it's reported in the media, if the parliamentary committees are aware of what governments have committed to and are asking governments about them, and if civil society and citizens know what their government has promised to do to achieve universal health coverage, then that's where they can be held to account through dialogue, through publicity, through campaigning, and of course through voting in elections. So from the civil society engagement mechanism, we strongly feel that the most important outcome of the high-level meeting is to promote greater accountability of governments towards their own citizens about universal health coverage. And there are a number of ways in which, as civil society, we can try to make sure that what governments say at the high-level meeting is right and useful. So first of all, there's talking to them anyway about their understanding of universal health coverage, how serious they are about reducing out-of-pocket payments, moving to publicly financed, fair access to healthcare, but also advocate that they take part in this high-level meeting. And we would like to encourage civil society in every country to start a dialogue with their governments about are they going to attend and what are they going to say when they get there. And if they're going to attend, what are they going to commit to, and start a dialogue about where the gaps are in universal health coverage in your particular country. And then to hold governments accountable for those commitments after the high-level meeting. We're very keen that there is some kind of mechanism that makes sure civil society knows what's been committed by its government and can then take the dialogue back into the country. And we should say that universal health coverage and the SDGs are meant to be universal. They're meant to be a shared responsibility across all governments. So high-income countries, who obviously in most cases are much closer to universal health coverage, are accountable for improving their own health systems, but also playing a part globally. But I think, and we'll come on to this next, it's again very much at the national level where the most important decisions are made. Next slide, please. So the CSEM has identified 4 priority areas which we are working on and which we believe should be the focus for the high-level meeting. And the first one is that we need increases in public health financing. We know that if you leave out-of-pocket payments high, if you leave healthcare to only those that have money, then that is not universal health coverage. What you have is the wealthy buying high-quality healthcare and the poor either having no healthcare or being pushed into poverty by having to sell assets or borrow money in order to pay for healthcare during a crisis. So increasing public financing, we've talked about a target of 5% of GDP as government health expenditure in every country. And if you look at low and low middle income countries, they are very far from that. Far too much of their health financing is spent out of pocket by individuals privately. The second area is on leave no one behind. One of the most important things about the SDGs is it said they're not interested in the targets as a national average, but that they are achieved in every segment of society. So if leave no one behind is real, it means structuring a health system that not only doesn't discriminate against people because they are poor, or where they live, which part of the country they live in, but also looking at other factors like whether services that improve the health of women are prioritized, whether services which work with poor and marginalized communities are prioritized. We're arguing that health workers are the most important aspect of a health system, and that you basically can't run a health system unless you grow your health workers. And of course, that's intrinsically linked with public financing. And we believe that civil society and citizens have to be involved in universal health coverage. You need civil society to be able to influence the way that health services are delivered, and to hold governments to account. Next slide, please. So these are some of the ways in which we are asking you to get involved in the high-level meeting. First of all, you select group have already taken part in one of our information webinars, and we're running a number. We're running some in Spanish, one in Spanish and one in French. We would like you to complete the survey that the CSEM has organized to try to inform what we want from the high-level meeting. And that civil society survey is on the CSEM website. I don't know if you can click the link I don't think you can click the link on there, but perhaps if we can type it into the chat box, that would be really useful for you to be able to have a link to go to that survey. And that's going to help shape what civil society is arguing for from the high-level meeting. There's another survey that's being run by UHC 2030. This is the partnership that Eliana introduced, which we are part of, which is a public-private partnership, intergovernment, a whole range of different stakeholders hosted by WHO and the World Bank. And so there is a survey they are running as well. So if you're in the mood for surveys, you can do both, but our priority would be to ask you really to do the first one. There is a civil society consultation happening at the conference in Africa this week on health, and that's a conference run by AMREF, and some civil society organizations have been able to fund themselves to be at that. There's also going to be one during the G20 in Japan, which is happening this year, and again, civil society will be asked for its priorities for UHC. There's going to be civil society sessions during the World Bank spring meetings, and the CSEM is organizing 14 advocacy meetings in countries, multi-stakeholder hearings in countries where civil society can engage with their government. And we're trying to support 14 countries to be able to do that. And finally, there is a multi-stakeholder hearing towards the high-level meeting happening on the 29th of April. And so the survey that we're asking you to fill in, the civil society survey, will be used. And I see that Refilaway has just pasted the link to the CSEM survey, so please do fill that in. Next slide, please.
I think that's it.
That's back to you, Eliana.
Thank you very much, Simon. That was great. So thank you, Refilwe. Please go ahead and jot down that link, but also, as Simon said, you can find the link to our survey on the CSEM website, which is csemonline.net. If you are already a member of the CSEM through our newsletter, you probably have already received an announcement of the survey. So check your inboxes if you haven't already to get the link as well. I will say, if you can't attend any of the face-to-face civil society consultations, whether it be this week in Kigali or at the G20 in Japan, don't worry. A lot of the discussion questions that we are going to be discussing in these face-to-face civil society consultations are actually what we have in our survey. So we wanted to give everybody the opportunity to provide as inputs, and the way we did that was through the survey, and then we will have those focused face-to-face conversations, but they'll primarily revolve around the same types of questions and topic areas. So don't feel like you're missing out if you can't attend those. Again, if you want to follow us, do so on Twitter, and if you need to reach us at any point, you can write to us over email. So with that, we have a little more than 30 minutes, which is great for questions and answers. So if anybody wants to ask a question, you can raise your hand, and I can give you audio privileges. And if anybody has a question from the chat box, we can read it out loud. So we see, let's see, hi, this is from Katarina. Which are the 14 countries where you are planning the HLM advocacy meetings? So we're in the process of finalizing those. I can send that information around as soon as I get the final decision from the groups that will be hosting these. So the CSEM will be a part of these, along with the IFRC, the International Federation of the Red Cross, and then UN AIDS is also partnering up to have these sessions. The sessions are going to happen after March, so between March and the high-level meeting in September. And we're in the process right now of defining exactly what these meetings are going to look like and creating a timeline of when they're going to happen in the different countries. And as soon as that's been defined, then we'll be sharing that through our CSEM newsletter. We'll be putting it on our website as well. And the idea is that we, as the 3 hosts, picked countries where we have the most presence. So in the 14, there may be more than 14, I think, as a final number, but the countries we selected either have an IFRC or UNAIDS office, or has a lot of CSEM members present in that country, or an advisory group member from the CSEM, for example, present. So as soon as that information comes out, if you would like to participate in these sessions, whether it be just as a participant or even participate as a presenter or a speaker, you'll have the opportunity to do that through the CSEM.
And I'd just add that just because we're trying to instigate these 14, this doesn't mean they're the only countries that should do this. We're ready to support, perhaps not financially, but certainly with materials, any civil society organisation that wants to get together civil society to try to engage with government before the high-level meeting. One of the things we're planning to produce is a little questionnaire template for you to use with your governments. So we'll collect up some of the data on how much government expenditure is on health, how much out-of-pocket payments are causing impoverishment, how much primary healthcare is being prioritised as opposed to other levels of the healthcare system. And that would provide a template to have a dialogue with government about what they're trying to do to change those things and what stepping stones they may make commitments to achieve on the path towards UHC in 2030. So please keep looking at the CSEM website and stay in touch with us if you're interested in doing something in each country.
I did accidentally skip a question. Mariska had asked whether we're organizing anything around WHA in Geneva in May. So that is something that we're still discussing with UHC 2030. So you'll be getting information on that very soon. We've already started talking to potential partners to set up a few side sessions, formal side sessions, informal side sessions. So as soon as we get those lined up, we'll be sharing that with you as well. So the answer is yes, but the details will come later. And I will get to you, Thomas. Just one more question from the chat that I wanted to get to. This is from Renee, is the CSCM newsletter for members only, or can others sign up as well? So if you are a CSCM member, then you should be receiving our newsletter. If you haven't signed up to be a member of the CSEM, then the newsletter isn't public. It just goes to our listserv. So if you're interested in getting that information, then I highly encourage you to sign up for the CSEM.
But just on that point, any civil society organisation that is working on health or interested in health should register to be a member of the CSEM. It's very broad and very open. So there's not really a difference between becoming a member of the CSEM and receiving the newsletter. It's aimed at civil societies to organise civil society. So if you are a civil society with an interest in health, please join.
Great. And I see Thomas has a question. Thomas, I'm unmuting you, so go ahead.
Thanks. This is Thomas from Medicus Mundi International. Thanks for the briefing. Thanks for the conversation so far. You know my reservations about the high-level meeting and the political declaration process. I have just 2 questions related. Regarding the ongoing consultations, I have my worries and I have my bad experiences, for example, referring to the Astana process, where I consider there that these consultations, in a way, you have the choice between a black box or a black hole. In the sense that if it's a black box, then you give your input, but you never know what happens with it, and you never know who is afterwards deciding on what input is considered. There is no reporting back. and there is no, in a way, you just, sometimes you just feel that you are doing something as to be a token in a process where they are not really interested in what you say. So the alternative is the black hole, that your input completely disappears, and you don't know at all what's going on. Related to this, and also to the Astana experience, do you at a certain moment, or would you at a certain moment consider, if you see that the process towards the declaration or the political statement to be adopted in New York, that this might lead to a result which is not satisfactory for civil society? Would you consider to set up a own statement, a civil society statement, as we had one in Astana? And if yes, how would you, when and how would you organize such a process leading towards strong civil society position paper or statement related to the high-level meeting? Thank you.
Maybe I can take this one. Thomas, I think your fears are very justified, and I think we've all seen many processes whereby there isn't meaningful engagement with the views of civil society, and that governments are intent on doing and saying what they want at the high-level meeting without listening to us. There are also questions about the legitimacy of civil society, which is questioned, who is the civil society that's going to be speaking on behalf? I think we're seeing a little bit that there are some organizations that are reasonably well funded and that are able to be at meetings. Maybe they have an interest in a particular aspect of health. We're trying to keep things as broad as possible and trying to make sure that civil society has a very broad perspective on UHC and on what affects access to healthcare. I think we will look to do a civil society statement alongside the high-level meeting in September. But at the moment, our energies are concentrated in trying to make sure that civil society's voice is recognised and respected, and to try and collate a broad voice on universal health coverage. I think the type of statement that we issue when it comes to it will depend on what's happening. If we think that there are good outcomes coming from the meeting, then we would be supportive. But if we think it's proving to be a waste of time and it's allowing governments which are refusing to invest in healthcare, which are leaving people to high out-of-pocket payments, and applauding governments for little innovative projects they're doing, for example, or overly endorsing the private sector, all of which are big risks, then I think we will be saying that, and I hope we will. There is undoubtedly kind of a lot of pressures. Every vertical group is very interested in the high-level meeting. The Global Fund replenishment happens 1 month after the high-level meeting, so we can see that Global Fund advocates are already very concentrated on making sure the high-level meeting endorses the replenishment of the Global Fund. I think that's very short-term and short-sighted when what we're talking about is universal health coverage by 2030. But I know everybody, probably if we went through the list of people on this webinar, are interested in a different aspect of health. I think getting the balance right between making sure you're there saying, and of course UHC is necessary for SRHR, UHC is necessary for neglected tropical diseases, UHC is necessary for non-communicable diseases, is important. But sometimes it seems as if people think UHC is going to happen and all they have to do is get in there and advocate for their particular topic. But we know universal health coverage is not happening in many countries. The number of people who are spending too much of their household income on healthcare costs and therefore being impoverished by it is going up. It's not going down, it's increasing. And government expenditure on health in low-income countries is not increasing either. So we need to make sure we stay on the broader topics, and that will be the essence of the CSEM's viewpoint.
Great, and I did want to just talk a little bit about how our survey is actually going to feed into the political declaration. Maybe just talk a little bit about the process, so people understand once they fill out the surveys what's going to happen after. So like I said, we have this survey, and we also have the face-to-face civil society consultations. And what's going to happen is we're going to gather all the data from the survey, as well as from the face-to-face consultations. And we're going to create a key asks document that's based on what is being requested or said on these surveys. So it would be an official CSEM key asks for the high-level meeting on UHC. We will be sharing this report with UHC 2030. The deadline is actually March 10th, which is coming up very soon. So again, if you haven't filled out the survey, definitely do so before that March 10th deadline, although it doesn't mean that that's the last time your inputs can be considered, but just for UHC 2030, that's when their deadline is. We are then, or UHC 2030 is then going to have a steering committee toward the end of March, and we're going to have our CSEM steering committee members, so Simon will be there in the meeting to ensure that our inputs from civil society are presented to the overall steering committee. They're going to be sharing the results to their survey, which is more focused on multi-stakeholders and quite different than the CSEM survey, so they'll be sharing that information as well. And then the idea is that the co-chairs of the steering committee put together all of these inputs and then present it to the facilitator of the high-level meeting on UHC. So that's the official process. The other reason why we want to do these in-country advocacy meetings is so that we can actually start presenting information on what civil society is already asking for via our survey and some of our face-to-face civil society consultations, and share that at the country level in those 14 possibly plus countries, and just add on to it based on what's said at the country level, and then just give them more of that information and messaging and communication that they can use to advocate at the country level so that their governments can actually influence the overall political declaration and ensure that these civil society inputs are included. So that's the other, there was a question about how, the 14 in-country advocacy meetings were going to influence the overall high-level meeting. And so that's one really important thing that we should mention. And like I said, the results of the survey will be presented to at the country level to the countries. We'll also be sharing that with our CSCM members through our listserv and posting that on our website as well. So again, there's going to be beyond this March 10th deadline an opportunity to use that information and then provide us with additional inputs to continue this advocacy process in the lead up to the high-level meeting. I hope that provides a little bit more clarity as well. Let's see. There was a question also from MIT. There seems to be a lot of focus on citizens' needs and voices, leaving out those left behind because they're not recognized as citizens or residents, migrants or refugees or displaced. Do we plan as CSO to address this, and how will this be done both at the specific countries and international level? And then the second question is, could you explain a bit more about the April 29th meeting at the UN and how these 14 stakeholder meetings feed into this? So like I said, I'll just start with that second question, but the idea for the 14 stakeholder meetings at the country level is to really get civil society inputs shared and communicated at the country level, and to also have civil society advocate so that their governments are part of this high-level meeting process. And then if you do attend the hearing in April, that's going to be an opportunity too for civil society to share its inputs and its asks for the high-level meeting. We will have people from the Civil Society Engagement Mechanism Advisory Group at this meeting that will be representing all the voices that we hear from through our survey and through our in-country meetings and through the face-to-face consultations. So if you can't make it to the hearing, whether it be because you couldn't get accreditation or you couldn't register on time or couldn't travel to New York at the time, that's also why we're having these opportunities for civil society to give us their input so that the people represented on the CSEM will be at the hearings sharing these inputs and these voices. In terms of the migrant information,
Will I say something about that?
Yeah, go ahead, Simon.
I mean, it's a really good point, and I think probably my language was being a little bit loose, talking about the relationship between citizens and the state, which of course we do want to emphasize, but we do see universal health coverage as leaving no one behind, and we absolutely recognize that in many countries, people who are not, because they haven't got the right citizen status, are being excluded from healthcare. We know that's happening in many, many countries. And so we're quite explicit about that. So our definition of leave no one behind does include non-registered people living in the country, which includes migrants and refugees, but may include ethnic minorities, internally displaced people within a country. So we need to make sure that's quite clear in how we're speaking about the principle of leave no one behind.
Thank you. And it also looks like my colleague Amy through a chat shared that in advance of the high-level meeting on UHC at the United Nations General Assembly in 2019, the international organization, the IOM, the International Organization for Migrants, has been involved in global, regional, and national discussions on UHC, and that IOM will continue to work with partners to champion initiatives that promote access to high-quality services for migrants to make UHC a reality. So you may want to go to the IOM's website or to link up with that network to learn more about how that's being done as well. Let me see if there are any other questions in the chat box. If not, if anybody wants to raise their hand, feel free to do so. Okay, so we have another question. How can we assure that CSO is represented in the consultations that several UHC 2030 working groups are organizing at present, in parallel with the overall input? Do we have an overview of which CSOs are part of which working groups, and if or how their input is considered? So I'm not sure if you're talking about the UHC 2030 working groups. So UHC 2030 has a few technical working groups that the CSEM does not lead, but we do have some advisory groups participate in those. They all work very differently, and they're all led by different people from the UHC 2030 core team. If you have a particular interest in hearing about what a particular working group is doing, you can actually see what the different working groups are on the UHC 2030 website. And for MIT, whoever asked this question, I only see MIT, but if you're really interested in migrants, the Fragile States Technical Working Group for UHC 2030 may have a lot of information on what they're doing in reference to migrants. So if you go on the website and there's a particular working group you want to find out more information on what they're doing in particular to UHC 2030 and the high-level meeting, you can shoot me an email or csem@msh.org an email, and I can put you in touch with the lead that's leading that technical working group. And if we do have an active advisory group member that's part of that working group, I can also put you in touch with that person to get some more information. So I hope that answers your question.
Shall we talk about the question about primary healthcare, which is from
Yes.
Hannah?
Perfect. Can
really
you read that out loud, Simon?
Yeah. So
okay.
Hannah asked, to what extent will primary healthcare play a role at the high-level meeting on universal health coverage? So I think what we know is that, there is a lot to debate around what universal health coverage means. And one concern that is regularly raised is that universal health coverage can mean anything in any country and doesn't necessarily prioritize the most essential health services that people need close to where they live. And so a big push for primary healthcare as the priority within UHC has been growing over the last couple of years. And with the Astana conference on primary healthcare last year, with the 20 years from Alma-Ata anniversary, not 20 years, sorry, it was 40 years, of Alma-Ata, then the real priority that primary healthcare should be identified within UHC. So it's something that's very strong in the CSEM's messaging, and I think very strong in the preparation towards the high-level meeting, because we can't have a high-level meeting where any government can just say, we're doing a health insurance scheme for the formally employed government officials, or we're doing something with some Gavi money where we're improving the immunization system in a country. We've got to get to making it meaningful and making sure that UHC is about universal access to primary health care without excluding people through payments or pushing people into poverty. And so primary healthcare, I think you'll hear a lot about that in the run-up to the high-level meeting. And certainly for the CSEM, we're very clear that we understand UHC as being first and foremost about those essential primary healthcare services. And there is already kind of some thinking around what kind of commitment governments can make to UHC that prioritizes primary healthcare.
Thank you, Simon. So it looks like Phillips from MSF, thank you. The UHC 2030 working groups are preparing also inputs, it seems, but not sure who. Okay, so yep, like I said, they work very independently from the CSEM and also are led by different people, so not all the technical working groups function the same or have the same activities. So if there's one in particular you're interested in, please let me know and I can link you up to the lead so you can see exactly what they're doing to provide inputs to the high-level meeting. Do we have any other questions? I see that I think we've covered everything in the chat box. If we haven't, please raise your hand. Do we have any questions, audio questions? Anybody that wants to speak up through the audio, make any comments to? Emma, is there any sense of the UHC consultations will feed into the GAP consultations?
Can I say a little bit about that?
Yes, please do.
I think these are two sort of processes, and undoubtedly they are going to keep linking in with each other. Just to explain to people, obviously UHC has the clear SDG target and the high-level meetings focused on UHC. But what has happened slightly more recently has been a push for the donor-focused global health initiatives to be better able to align what they're doing and work together better. And this is called the Global Action Plan for SDG 3. So this is very much about multilateral mechanisms, aid-driven mechanisms, which undoubtedly need to improve and which we know don't play much of a part in building universal health coverage. Generally, Gavi is interested in immunization, the Global Fund is interested in HIV, TB and malaria, UNFPA's commodities supplies are interested in reproductive health, etc. So getting them to work together better is undoubtedly important and a contribution to building universal health coverage. Aid should be a contribution to building universal health coverage. But I would also argue that we shouldn't be too distracted by this. There's a real tendency to recognize that talking about tax and social health insurance and the structuring of health services in countries is extremely difficult, and often governments don't want to have much of a dialogue about that. Whereas talking about what the aid mechanisms are doing with much smaller amounts of money, of course, is easier. And I think we've got to keep the balance right and not get drawn into being wholly focused on improving or trying to improve what Gavi and the Global Fund and the Polio Eradication Initiative are doing. We need to make sure, and it's why the CSEM has public financing at national level as its top priority. But we do also need to make sure these two processes talk to each other and that the global multilateral health institutions are contributing to universal health coverage.
Thank you. I do have just some more information related to the GAP. So for those of you that have been members of the CSEM for a while, you might remember that we actually created a declaration, or not really a declaration, but it was a letter that we wrote to Tedros with recommendations on how the civil society should participate or provide inputs to the overall global action planning process. As a result of that, Tedros's team responded by saying, yes, we certainly accept that recommendation and would like for you all to create a platform for civil society to be able to provide inputs to the global action plan. So as a result of that, GFAN and the CSEM in December had a meeting with a few of the multilateral stakeholders that are part of the GAP process. And we also had involved a lot of civil society. Well, we had a handful of civil society. Can't remember how many participants overall we had. It might have been about 26, but it was about half civil society and then half the organizations that are all a part of this GAP process. And in that meeting, we learned from the stakeholders exactly what the process of developing the GAP was and what phase it's in. So there was a development phase of the GAP, and now they're kind of in a consultation phase to try to get inputs from various stakeholders as to how they can, improve what's already in the GAP. And the initial development of the global action planning process did not involve civil society, and that was very clear. And so as a result of that meeting in December, it was decided that there would be a specific civil society advisory group for the GAP. And that this group would be responsible for ensuring that civil society can provide inputs to the global action planning process at different points in time. And the CSEM, it was decided that the CSEM would be kind of like the administrative platform of this advisory group, but that the advisory group would be made up of various different representatives from civil society organizations and constituencies. So you might have seen that we released an expression of interest, a public expression of interest, and we were able to assemble an advisory group for the GAP. And if you're interested in learning more about it, please go on our website. We have a whole page dedicated to this advisory group. You can see who's on it, where they're from, what organizations they're from. And they're going to be responsible for leading this process for civil society to provide inputs to the GAP process. And we have one advisory group member from the CSEM that's part of this GAP advisory group, and we're working very closely so that all of the inputs that we're getting for the high-level meeting through our survey and through the face-to-face meetings, that they're all, we're sharing that information with the GAP, because there is quite a bit of overlap, and there are a lot of civil society inputs that we're getting from our survey that are going to benefit the global action planning process. So there's going to be a lot of knowledge sharing in that way as well. And of course, if you're interested in being a part of any of the global action planning civil society input activities or opportunities, you can always reach out to the CSEM. You'll be hearing more about what those opportunities are going to be very soon. We just assembled the advisory group, so they're in the process right now of creating an activity plan for what they're going to do, and we'll be sharing that with you all. So I hope that also provides some information. Okay, I see a hand up. I think this is T. Brace. Let me unmute you so you can speak. Go ahead.
Hi, I'm Tara from Save the Children.
Hi, Tara. Sorry about that. I know you. Go ahead.
No, I was just, I'm concerned that we are only talking of civil society organizations. The whole engagement process is for organizations as well as citizens. And if we are talking of the most marginalized, what are our plans to actually engage and listen to the voices of the most marginalized in countries? Because we can't assume that CSOs are inclusive.
Yeah, exactly. Simon, I can start, and if you have anything to
Okay.
add, please go ahead. But that was really the reason why we wanted to do a lot of these in-country advocacy meetings at the country level. Because it is important when we do have these meetings for us to, we're planning on inviting, leaders from different communities, ensuring that we have some of these more vulnerable and key populations represented at these meetings. And it'll be important for us to bring, everybody together, not just CSOs, but as you say, citizens and communities to be a part of this overall process. So it's really hard when you're working at the global level with these global surveys, and to really get down to the community and local levels and ensure that those people that usually aren't heard are also represented. And so that's why we're trying to focus our in-country advocacy meetings on giving those people the opportunity to be represented in this entire process. So I would say that that's one of our strategies for the high-level meeting.
I mean, I think your point, Tara, is really important, that we know that, even as civil society, we marginalize people. There are lots of groups that are not automatically going to be included or represented. And I think that's a challenge for us to try to encourage national level dialogue, to think about those most left behind, most excluded, and to try and promote their voice.
Yeah, most definitely. Okay, so we have about 3 minutes left. Any final questions or comments? Again, you can raise your hand.
I might just respond to the point that Thomas has made, is that the CSEM survey is very much aimed at civil society in lower middle income countries, and is not so much about the donor countries. Now, of course, we know that every country, including high income countries, has gaps in its universal health coverage, and has people who are excluded, inequities in the way that services are delivered. And so there is a kind of a question, first and foremost, to civil society organizations in countries that are high income about their own countries. But there is perhaps missing question in there about the role of donors and what we want donors to do to support UHC. So I think we'll take that on board and look at whether either we can add in an additional question or just provide a chance for people to send in their comments. Okay, I think we're finishing now. I'm not sure if Eliana's gone mute.
Sorry, I was just speaking on mute. I'm sorry, everyone. So we are ending. I just wanted to say a quick note. Did you want to just say any final comments, Simon, first?
No, just to encourage people to get involved. This has been really helpful in giving us some more steer around what we should be thinking about. But let's make sure that we try and get some good outcomes out of this high-level meeting. It's a once-in-a-decade chance to get some commitments to changes in the way that health services are structured in countries. So let's not waste it.
Great. Thank you so much, Simon. And please write to us at csem@msh.org if you want to get involved in any of the activities that you heard about today. We're really eager to get more of our members involved in these different activities. If you are a member of the CSEM and you haven't been receiving our newsletter or announcements, it may be going to your spam folders. So we recommend that you add csem@msh.org to your contact list, or clear it as a safe email so that you can avoid having these communications going to your spam. I'm actually going to go ahead and type in the chat my email address. So you're also welcome to contact me directly if you have any more questions or comments about the CSEM or UHC, any of the technical working groups. If you want to get involved, if you have stories you want us to spotlight in our website, please go ahead and email me directly if you'd like. So thank you everybody for your participation, and this will be recorded, or it has been recorded and will be posted on our website along with the PowerPoint presentation, so you'll have access to all the links. So thank you again.